Assalamu alaikum. I'm Dr. Ahmed Lutfi. I'm a consultant gynecologist. The part of the course of the reproductive physiology is about the female reproductive systems, organs, and functions. And the start of the female reproductive system will be knowledge about genetic development and anatomy of female reproductive organs. Again, I would like to highlight that there will be new words. All of us, we need to know to understand the doctor's language, the medical language. So we need to know what's the meaning of uterus, ovaries, fallopian tubes, cervix, vagina, ovum, and so on. There are a few new words. All of us, we need to master. So if you speak to a doctor and you tell him like Mullerian duct, the doctor will understand. So you need to know what is Mullerian duct, what is the, for example, the urogenital sinus, the what is urogenital sinus. So you need to know about all this, and it will be easy with repetition during the course. So all these words will be repeated on and on until all of us will master it, will master its meanings. The indifferent embryo, the baby in the uterus, has a genotype of either female, 46 with XX chromosome, so 23 pairs, 22 autosomal chromosomes, and 1 sex chromosomes, either XX or XY. XX female, XY is a male. At 1 to 6 weeks, it is sexually indifferent or undifferentiated stage. So the baby in the uterus from the start is either male or female, but anatomically or phenotypically you cannot differentiate before 6 weeks. So from 1 to 6 weeks we cannot differentiate from anatomical point of view. At week 7 the phenotypic sexual differentiation starts. Week 12, female or male characteristics of external genitalia can be recognized by an ultrasound or with an examination of after miscarriage. Week 20, the differentiation is complete. So at week 20 ultrasound, you can tell whether it is male or female. Development of genital ducts. Both male and female embryos have 2 pairs of genital ducts. Genital ducts which connect the gonads, either ovaries or tubes, to the genital organs. So attach the ovaries to fallopian tubes and uterus, and attach the testes to the vas deferens, ductus deferens, epididymis, and also attach it to the accessory glands, seminal vesicles, prostate, and the pulpourethral gland. These 2 ducts, the names of them is mesonephric ducts, Wolffian ducts, and the para-mesonephric ducts. The mesonephric ducts play an important role in development of male reproductive system. It is the embryonic start of the epididymis and the ductus deferens in the male. The paramesonephric ducts, the Mullerian ducts, have a leading role in the development of the female reproductive system. These Mullerian ducts will form the fallopian tubes and will fuse together for both sides to form the uterus and cervix and upper part of the vagina. Till the end of 6 weeks, the genital system still indifferent. Both birds of the genital ducts are present. This is just diagrammatic picture. Again, diagrammatic picture of the mesonephric and paramesonephric ducts. Here you can see the end of these ducts, the paramesonephric ducts, the fallopian tube. This is the fallopian tube, these are the ovaries, and part of the fallopian tubes is just coming from the mesonephric, but most of it is from Mullerian paramesonephric duct, and the two tubes fuse together to form the uterus and upper part of the vagina. In the male, this is the female. In the male, this is forming the mesonephric duct, the epididymis, and the ductus deferens, the vas deferens, which passes through the urethra and get connected to the seminal vesicles. These ovaries and tests, and before 6 weeks, both ducts are present in the embryo, Mullerian and Wolffian ducts, Mullerian duct, Wolffian ducts, mesonephric and paramesonephric. After the lower Mullerian duct fuse, a central septum still present. When they fuse, there is a central septum which is still present, but this septum will be reabsorbed to form a single uterine cavity. Failure of reabsorption between 14-18 weeks gestation is the cause of septate uterus. And septate uterus causes problems, either sometimes miscarriages, sometimes premature labors, which is needs some treatment. The vagina in 3 months embryonic life, from the lower end of the uterovaginal canal, Mullerian duct, and urogenital sinus. The urogenital sinus is forming part of the vagina and the urethra and the bladder, and so the urogenital canal fuses with sinovaginal pulp to develop the posterior aspect of urogenital sinus. You need to understand this relationship. So if the patient suffers from prolapse of the vagina, which is protruding down the vagina or the uterus cervix, and you are going to operate on it to raise it up and repair the defect in the fascia, then you need to understand the relationship between the bladder, urethra, and the vagina, and the cervix and the uterus. Again, diagrammatic picture. So we know now upper third develop from Mullerian duct, the lower 2/3 develop from vaginal blade. This is the vagina. Incomplete breakdown of junction between the pulp and urethrovaginal sinus make a hymenal membrane. Hymenal membrane, it's there just to give partial closure of the vagina, partial closure of the vagina by hymenal membrane. So female reproductive system, the human female reproductive system is divided into two, internal and external. Internal genital organs and external genital organs. Internal genital organs, they are the vagina, cervix, uterus, fallopian tubes, and ovaries. This is the picture of the vagina, cervix, uterus, fallopian tubes, and ovaries. And the external genital organs, mons pubis, the above the symphysis pubis, labia majora and labia minora, clitoris, hymen, vestibular gland, Bartholin glands to secrete mucus to lubricate the vagina, urethral orifice, vaginal orifice, perineum, and anus. This is the picture of the female external reproductive organ. The mons veneris is the area of the skin and fat above the symphysis pubis, pubic bone, and labia majora, the fold of skin surrounding the vagina, large fold of skin surrounding the vagina, and a thin fold of skin surrounding the vagina is labia minora. And a vestibule is the area between the top of the labia minora. This is the vestibule, labia minus, the vestibule here at the top of the labia minus. And the perineum is the area between the vagina and the anus, with the perineal body here. The vaginal orifice with the hymen, and there is urethra. Clitoris is equivalent to the same tissues of the penis, clitoris. So we need to know all these names and their functions. The vagina is the canal that joins the cervix, the lower part of the uterus, to the outside of the body. Relation with other pelvic organs, muscle, fascia, and tissues. Upper 1/3 is related to the base of the bladder. And the lower 2/3 are with the urethra, and the lower half of which is firmly embedded with its wall. Posterior upper third is related to the pouch of Douglas. It's a peritoneum pouch of Douglas, peritoneum pouch between the rectum and the uterus. Pouch of Douglas, this is the upper third. The middle third with the rectal wall, separated by vaginorectal septum. The lower third is separated from the anal canal by the perineal body. And the lateral wall of the vagina is related to the pelvic cellular tissue at the base of the broad ligament. This is the organs of the female reproductive system: the uterus, the vagina, related to the bladder and urethra anteriorly, and to the rectum posteriorly, and separated in the top from the rectum by the peritoneal pouch. The vagina secretes mucus and the parsuling gland also of the actually the parsuling gland are in the vulva that secretes mucus for lubrication. Vaginal pH from puberty to menopause is acidic because of the presence of Doederlein's bacilli, which produce lactic acid from glycogen present in the exfoliated cell. There are exfoliated cells in the vagina, and the Doederlein bacilli produce lactic acid from glycogen. The pH of the vagina with estrogenic acidity ranges from 4 to 5. It's about 4 to 5, the pH, acidic. The blood supply of the reproductive organs mainly the blood supply of the reproductive organs coming from the internal iliac artery. From the internal iliac artery with its branches, uterine artery, vaginal artery, middle rectal artery, internal duodenal. All of these arteries are coming from the internal iliac arteries. And the drains as well, it is into the internal iliac vein and internal duodenal vein. And the internal iliac artery will go to the common iliac artery and then to aorta. Lymphatic drainage also important. If you are dealing with cancer cases, you need to know the drainage of the lymph. Lymphatic drainage mostly to internal iliac and external iliac lymph nodes, and certain parts of the vagina will go to the superficial inguinal group of lymph nodes. The nerve supply, the vagina is supplied by sympathetic and parasympathetic from pelvic plexus. The lower part is supplied by the pudendal nerve. The uterus, the womb, is a hollow pear-shaped organ that is a home to a developing fetus, home of the pregnancy. Here is the uterus. This is the vagina, then the cervix, lower part of the uterus, then the body of the uterus, and this is the fallopian tube and the ovary. The body of the uterus and the cervix as well has three parts, three layers, perimetrium and myometrium and endometrium. Perimetrium is the peritoneal cover of the uterus, and the myometrium is the muscle layer of the uterus, and endometrium is the lining, the epithelial lining of the wall of the internal wall of the uterus. And this is a peritoneal fold called the broad ligament, just to have all the blood vessels, surround the blood vessels and the lymphatic vessels of the reproductive organs. The broad ligaments is just two leaves which surrounding the blood vessels of the reproductive organs. This is the uterus, is fundus and body and cervix. There is part in the called isthmus, and isthmus is a constricted part measuring about 0.5 centimeters situated between the body and the cervix of the uterus, and this isthmus will form the lower uterine segment in late in the last weeks of pregnancy in prima gravida or after the start of labor in multipara, prima gravida first pregnancy, and multipara second, third, and fourth pregnancy. Cervix is cylindrical in shape, measured about 2.5 centimeter, and it extends from the isthmus to the end of the external os. And the cervix has a lining mucus, secretes mucus, which is watery at time of ovulation and thick more at time of secretory phase of the endometrial cycle. And we are going to know the different functions of the cervical mucus later. This is the cervix here. If you put speculum, you put speculum and the vagina, you see the cervix with its secretion. This is the external os. There is an internal os at the end of the cervix, and this is the walls of the vagina. We said that the parametrium is the peritoneal cover of the uterus and cervix, and the myometrium the muscle layer, and the endometrium is the mucus lining of the cavity and is called endometrium. It consists of lamina propria and surface epithelium. The surface epithelium is a single layer of ciliated columnar epithelium. The endometrium is columnar epithelium, which changes also in thickness during menstrual cycle. During pregnancy, it will change into decidua. This decidua is the name of the endometrium during pregnancy. Decidua is the secretory thick endometrium, which is important for implantation of the embryo and also for the implantation of the placenta during pregnancy. All these anatomical structures is important from anatomical point of view: the arterial supply, the venous drainage, the nerve supply. Mainly the uterus, vagina is coming, blood supply and drainage is coming from internal iliac blood vessels. The ovaries, the blood supply is coming from the ovarian arteries, which are branches of the aorta, directly from aorta. And the drainage, the left ovarian vein drains in the left renal vein, and the right ovarian vein drains into the inferior vena cava. Ovaries are a small oval-shaped gland which are located on either side of the uterus. The ovaries produce eggs and hormones, estrogen, progesterone, and androgens. It measures about 3 centimeters in length, 2 centimeters in breadth, and 1 centimeter in thickness. It has different stages of the eggs, from primordial follicles to oocytes to primary oocyte, secondary oocyte, and oocyte, which is the egg, and after rupture of the Graafian follicle with the release of the egg, the formation of corpus luteum. And after this corpus luteum, if pregnancy will not happen, the corpus luteum will undergo atresia to atretic follicle or corpus albicans. And this corpus albicans forms a fibrous part of the ovary which secretes androgens. The follicles, the Graafian follicles, secretes estrogen, and the corpus luteum secretes progesterone. This is the relation of the ovary to the surroundings. The most important thing that we need to know that the ovary lies in a fossa. Usually the ovary can be isomobile from the peritoneal fossa, which is related to the ureter and the internal iliac vessels. But if the ovary is so adherent to the peritoneal fossa because of a disease called endometriosis, and surgically to release the ovary to reduce the pain of this disease, we need to be careful at the ureter and the internal iliac vessel just beneath this fossa of the ovary. Ovary consists of cortex and medulla. The cortex has germinal epithelium, and germinal epithelium with follicles, Graafian follicles, and corpus luteum, corpus albicans, and medulla, which is formed from interstitial tissues, and these interstitial tissues secretes androgen, different types of weak androgens. Fallopian tubes is tube from the ovary, and if you have a laparoscopy, if you do laparoscopy at the time of ovulation, you will see the fimbrial part of the ovary as like fingers holding the ovary to get the egg from the ovary to the fallopian tube. So ovary to fallopian tubes, and then the eggs stay there for about 24 hours waiting for fertilization by sperms. And if fertilization doesn't happen, this egg will disintegrate into the peritoneum. The fallopian tube itself is forming from fimbrial end, then ampulla, the largest part, then the isthmus, which is narrowest part, and sometimes ectopic pregnancy in the isthmus happens and lead to rupture, which is life-threatening condition. Here is the fimbrial part, Then the infundibulum. Infundibulum is a cone attached to the fimbrial part, and then the ampulla, which is supposed to be widest part, and then the isthmus, the narrowest part of the tube, and the isthmus continue into the cornea of the uterus of the womb. The covering of the lining of the fallopian tubes is ciliated columnar epithelium, and it moves either ways to help the movement of the fertilized egg back to uterus for implantation, or the movement of the sperms to meet the egg for fertilization. And also there is secretory columnar cells and Beck cells secreting. They are secretory cells to give some lubrication to the fallopian tubes. And the function of these fallopian tubes: transport of gametes, whether they are sperms or egg or fertilized egg, and these to facilitate fertilization and survival of zygote with its secretion. A zygote is a fertilized egg. Blood supply is from uterine and ovarian arteries. The ovaries and the tubes lymphatic drainage is to the para-aortic lymph nodes. We need to understand or know the muscles of the perineum, because this will help us to know the function of these muscles to protect the internal organs of the reproductive system from prolapsing and protruding to outside. Any weakness of these muscles will lead to, or its covering fascia, will lead to a prolapse of the vagina, whether anteriorly with the bladder or posteriorly with the rectum, or prolapse of the uterus to outside. And obviously this will be very distressing to the woman if she has a large balloon containing bladder or rectum or uterus between her legs, and the treatment of this condition is to push the vagina with its content upward inside, and then open the vagina and the surrounding fascia and muscles, and resuture it, repair any gap to prevent the recurrence of the prolapse. So if we are going to deal with female reproductive organs, we need to understand the superficial and deep layers of these muscles. Superficial layers, mainly the transverse superficial layers, and the external sphincter of the muscle, the external sphincter of the anus, they are all superficial part of the perineal muscles. The levatorinae muscle, which is the deep part, is 3 parts. Pubococcygeus muscle, and iliococcygeus and ischio-coccygeus is just like a bottom of a boat between the both perineal muscles from either side, between the pubic iliac bone and ischial bone to the perineal body, just like a bottom of a boat. This is the vagina. Sometimes during delivery, you need to cut through these muscles to extend the vagina to allow safe delivery of the baby, especially in first time. So when you cut, after giving local or regional anesthesia, when you cut, you need to understand these superficial and deep parts of the muscles, and also when you repair it back. And thank you very much. This will be the end of the presentation of genetic development and anatomy of the reproductive organs. And next will be the function of each part of this system. Thank you.